In the clinical population, it may be dangerous to test them maximally. Therefore, it is a common practice to test it is a common practice to estimate a maximum capacity with a submaximal intensity, such as 85%. The Bruce protocol allows for a 3-minute stage, which is allowing a steady state or cardiorespiratory regulation. In the NDKS, it's a 2-minute stage, which is a lot shorter, which allows for less cardiorespiratory regulation or steady state. One of the limitations to the Bruce protocol is that a participant must finish a 3-minute stage in order for that estimation to take place. The purpose of the study is to compare through the submax Bruce and NDKS in the response to heart rate, blood pressure, lactate, glucose depletion, rate of perceived exertion, angina and claudication as well. One of the assumptions to the study is that peak lactate levels will be higher in NDKS protocol. Male participants will sustain a longer test, and all measurements for men will be higher in comparison to women. The difference between the Bruce and NDKS protocols will allow for the conductor to choose the test between the patient's characteristics. Everything on the left side here happened in the first meeting. We met 3 times. In the first meeting, they were familiarized with the protocol or the testing protocol and procedures. They were given an informed consent and a health history questionnaire. Through the health history questionnaire, risk stratification took place, and they were either included or excluded based on their low risk factor. Anything moderate or above were excluded from the test. Once they were included in the test, they came in and they were given either the submaximal Bruce or NDKS randomly. Some of the instruments used for the study are the heart rate monitor, polar band, and polar watch, the Littman stethoscope and sphygmomanometer, a self-check true test glucose kit and lactate kit as well, and a treadmill by Woodway. Here we see the yellow stars, which are showing a significant difference in the protocol. The red stars are showing a significant difference in gender per protocol. Here it's obvious that the Bruce protocol has induced a higher systolic blood pressure. Take notice to the numbers within the bars. Those are the difference from resting to maximal measures as well. So men had also a higher systolic blood pressure in the Bruce and higher than women in general as well. Here in systolic blood pressure, the only significant difference is within gender, as men had a higher systolic blood pressure than women. In regards to lactate, there was a difference within the protocol and the gender as well. Men had a higher lactate threshold, peak lactate than women, and men and women had a higher lactate peak in the NDKS than in the Bruce protocol. Here we have a graph showing the glucose depletion. The NDKS induced a larger amount of glucose depletion than the Bruce protocol did, and also men had a lot bigger drop in glucose than women as well. And as far as the RPE scale is rate of perceived exertion. It is a scale from 6 to 20, 6 being resting heart rate, or 60 being the average person's resting heart rate, and 20 being maximal. We'd expect, because of the submaximal intensity, for these people to come up to an 18 in the scale of 6 to 20. Therefore, as you see, nobody did, which is a big surprise in the study. However, women had a higher RPE than women did in the Bruce. Women had a higher RPE in the NDKS than in the Bruce protocol, and men had a higher RPE overall. The duration of the test in the Bruce was longer significantly than the NDKS protocol. Some of the limitations to the study are I was not able to take glucose and lactate per stage. Therefore, the dynamics of that are halted. I used a very narrow age range of adults from 18 to 26 years old. I had a small sample size of 20 individuals with an uneven sample in gender, as far as 13 to 7. And sleep, caffeine, exercise, and stress were attempted to be controlled, however, they were self-reported. And discussion. Within gender, the systolic blood pressure within gender, the Bruce protocol induced a higher systolic blood pressure, and this may be due to systolic blood pressure regulation to workload. Due to the design of the study, I was not able to prove this possibility. Men presenting a higher systolic blood pressure than women in general is not a surprise, as is well documented in literature that men have a higher capacity and tolerance to exercise in regards to women as well. Higher systolic blood pressure in men is believed to be due to greater peripheral resistance and blood circulation in comparison to women. Also can be concerned in the diastolic blood pressure as well. Going further, peak lactate levels were higher in the NDKS protocol, which may be attributed to less cardiorespiratory regulation or steady state. Lower lactate levels in men may be explained due to greater cardiac output. And the glucose depletion was also greater in NDKS protocol regardless of gender and greater in men than women. And this may be explained due to greater muscle mass and power output of men's aerobic capacity, which results from a greater musculature and skeletal work and a demand for glucose. In addition, NDKS is a ramping protocol preventing better cardiovascular regulation, which myocytes must depend on glucose in order to give energy. And in theory, as RPE goes, every 10 beats per minute, we should have gone up 1 unit in RPE, which did not happen. RPE, or rate of perceived exertion, is completely subjective, and which makes it unclear for the reasons of which of these outcomes. Duration of the Bruce test was longer, also longer for men in regards to women, and as far as the test goes as well, and can be attributed to better cardiovascular regulation and sorry for the typo here, and better aerobic capacity on the other hand. In conclusion, it seems that the 3-minute stages in the Bruce protocol allow for a better cardiovascular regulation in comparison to NDKS. Both protocols allowed for each participant to finish the study without any reported injury or event. And what's most important is, due to the advantages and disadvantages of the protocols, either test can be chosen based on the characteristics of the participant. In future study, I suggest that we use a maximal comparison between the NDKS and Bruce using the inclusion of gas exchange, electrocardiogram, or ECG, and maximal VO2 in both men and women. Adding blood glucose and lactate per stage will also give a more dynamic reading of that incremental change in blood glucose and lactate. I'd also prefer to use a larger sample, larger than the 20 that was used in the study, and a more even group in regard to the gender size. Special thanks to Woodway for endorsing an awesome treadmill to help me complete my study. And also special thanks to Dr. Jill Newstad, Dr. Moran, Kayla Dressler, and Jason Kovacs as well. Thank you.